The outcome was that the patients who were suffering from severe anemia, because you know that when a patient's kidneys are suffering, erythropoietin is not produced in the sufficient quantity, so the hemoglobin level drops, and in order to maintain the hemoglobin level, the patients are injected with erythropoietin, and in addition to that, after every 3 months they have to be transfused. A bottle of blood is transfused after 3 months. This is their common practice. But when we performed Hijama for almost 2.5 years, we saw that the hemoglobin level was improved from which was previously 8 or 9, but it improved to 11 or 12 without the need of transfusing for 2.5 years. Alhamdulillah, their hemoglobin level kept improved or sustained at that level. So this is one of the results which we saw, that the it may be because of the improved function of kidney, or maybe because of the improved function of the bone marrow, which is producing the RBCs or the hemoglobin. And then we saw that the patients were suffering previously from severe insomnia, like I mean the lack of sleep. So when they were suffering from insomnia, due to that their blood pressure kept raising. The blood pressure is directly affected by insomnia. I have seen it many times in thousands of patients, that alhamdulillah, that due to insomnia blood pressure raises, and with Hijama insomnia is relieved. Alhamdulillah, insomnia is it gets a lot better. So in those patients we also experienced that, we also observed that their insomnia was relieved, and alhamdulillah, because due to that their blood pressure was lowered, because previously, and you know that when kidneys are not working properly, the blood pressure raises to above 200 in the case of systolic, and above or around 140 the diastolic. This was the case in those patients. They still continued their dialysis. This is the thing which we concluded, because you know our target was that their dialysis should be stopped and they should return to the normal life, but they returned to the normal life. Before Hijama they were just lying on beds waiting for death, but after Hijama, what happened, they were able to perform their jobs. Some of them were rickshaw drivers, some of them were general store salesmen, some of them were tailors, like that. So they started working again, and their dialysis was it came in routine, like they were coming for dialysis 3 times a week, and because they were end stage renal failure patients. Some of them were on maintained on dialysis on more than a year, on 2 years, for some of them for 3 years, and still some because the rate of death is very high in those patients, but some of them are alhamdulillah still alive, and they are going through Hijama still.